Dear friends, I would have very much liked to be with you in San Francisco at the NCD Child and Adolescent Conference, especially in the wake of the UN high-level meeting on NCDs. I would like to thank NCD Child and all its committee members and participants for organizing this extremely important conference and for working so hard to ensure that children with chronic diseases receive the care they need, regardless of where they live. I was sitting in my office at the King Hussein Cancer Foundation one day when I received a frantic call from a staff member. A mother and child had arrived unceremoniously on the doorstep of our medical facilities. The mother was penniless. The child, a beautiful 4-year-old girl suffering from leukemia, her name was Zainab. Zainab and her mother had traveled from their homeland Syria, where there is no access to cancer care, all the way to Jordan to place their hopes on our doorstep, having heard that our center, the King Hussein Cancer Center, is the best in the region. The estimated cost of Zainab's treatment was $100,000. Our goodwill funds were depleted as we are already overburdened with hundreds of patients who need financial support. And the staff member on the other end of the line was asking, what should we say to Zainab's mother? As I held the phone in my hand, there were two things I knew for sure. One, this lovely little girl had her whole life in front of her, if she could only be given the chance for a cure. And two, as the mother of a child who has survived leukemia, it was impossible for me to turn her away. We would have to find a way to cover her treatment costs later. In the developing world, this inequity is something that we face every day. To us, the disparity of cancer care is a little girl with smooth skin and soft brown hair, who has a disease with a 90% chance of a cure, and who looks at us with her big brown eyes, full of unspeakable pain, and asks us all, will you treat me? This story is multiplied over and over again in developing countries, not just with cancer, but with other NCDs as well. These developing countries are struggling with the delivery of basic health care, accessibility to essential drugs, and a deficit of specialists and specialized centers required for the treatment of complex diseases such as cancer. The good news is that we have already come a long way. We finally have a political declaration that sets the foundation to galvanize efforts for the global action needed to address and control NCDs. We already have the science, the knowledge, and the proven interventions that can truly make a dent on NCDs. It is admirable that the political declaration puts emphasis on governments to start dealing with the issues of prevention, which will certainly hinder the epidemic of these diseases. But what about the people who are suffering now? The people who need treatment now? The crucial question is, how do we take all these incredible amount of information that we know and actually see it translated on the ground? To go back to our example, we know that leukemia has a 90% chance of a cure. We know the protocol required to achieve the best chance for this cure. So why is it that until now we are unable to utilize all the science and technology within our grasp to actually have a child receive the standard leukemia protocol in, let's say, Africa? In my humble opinion, we need a reality check. As the situation stands, we have not been able to achieve a global fund, like AIDS, to give the right punch in this fight. We are dealing with low-income, resource-poor settings. We know that governments, despite their best intentions, will not be able to deal effectively with the treatment of expensive and complex NCDs. And yet, we still have lack of trained specialists to deal with these diseases. Yet at the same time, the international community would like to see us taking on all the diseases at once, and the entire spectrum from prevention to palliation, even knowing that we don't have the funds or the resources to do it. This is why I feel we should focus. we need to look at a successful model and a manageable disease. Take the example of Partners in Health. Through real and systemized partnerships with top hospitals around the world, they were able to deliver cancer care treatment in absolutely low resource settings, safely and effectively in Rwanda and Haiti, and thereby saving precious lives who would have otherwise died needlessly. And then, if we are to focus at childhood cancers, or even only leukemia, for instance, and take from Partners in Health's success and experience, we can start to build a system, taking on all the realities, outsourcing the more complex procedures such as diagnosis, using telesynergy where needed, starting training centers to train specialists on a regional basis, and effectively putting in place a system which provides the next best thing without compromising quality. Once we start to do that, I feel that we will help all other diseases because a start would have been made and a process identified. Because currently, with all our best intentions, we are trying to take on all the various elements, and yet we are remaining masters of none. This is why the work of NCD Child and all of you here today is so important. You are creating that much needed focus. You are seeking to establish the proper systems that will deliver care to children and adolescents. You are ensuring that all the Zainabs in the world have the chance for treatment and a real chance for a cure, not only from cancer, but from any NCD, regardless of where they live. Good luck today in the conference, and thank you very much from all of us here at the King Hussein Cancer Foundation in Jordan.